A lack of skilled assistance during childbirth and poor access to emergency care kills 500,000 mothers in developing countries each year. In Bangladesh, these shortcomings also cause thousands to suffer internal injuries that leave them incontinent and social outcasts. Most of the women and teenage girls with the degrading condition called obstetric fistula endured a long ordeal of obstructed labor. Many were married early, before their young bodies were ready to give birth. With assistance from UNFPA, the United Nations Population Fund, a growing number of these women are getting a new start. Sultana is one of them. 6 years ago, while she tried to give birth at her home outside Sylhet, tragedy struck.
I was in labor at home for 2 days with no progress. The pain became severe. I was brought to the clinic, but they wouldn't deliver me. My husband didn't want to pay for an ambulance. I was finally taken to the hospital, and the doctors removed my dead baby. When I woke up 3 days later, my mom was cleaning feces and urine from me.
The undelivered fetus had created holes in Sultana's insides, leaving her unable to control her bowels or bladder. She was cast out of her in-laws' house, and her husband said she'd be better off dead. But Sultana was luckier than many women with fistula. Her own family took her in, and a doctor said her injuries could be repaired. She could not afford to go to Dhaka for treatment, but surgeons in Sylhet had recently begun to perform the procedure, thanks to a national training effort.
In Sylhet, there is many bar regarding contraception taking. So there is more childbearing, early marriage. So there is complicated labor, obstructed labor and prolonged labor. And after training from Dhaka National Fistula Center, we are now more expert and we are doing all the complicated cases.
Sultana's severe wounds required multiple operations spread over several years.
After each operation, I came home and rested for a month or two, and then returned to the hospital. Sometimes I thought, oh my God, I can't stand this anymore. I told the doctors, give me poison so I can die.
Her father sold his livestock to support Sultana, and her mother stayed with her at the hospital, washing clothes to pay for medicine. The place was so big and scary, we had no money. I worked day and night for other patients. I was begging everyone, please give me some rice for my daughter. I lived on betel nuts. After 8 operations, Sultana finally recovered from her injuries. She is now an advocate, spreading the word in her community that fistula can be cured and prevented. As one of its activities to combat fistula, UNFPA is helping train surgeons from hospitals throughout Bangladesh. UNFPA is also working to prevent fistula by supporting midwife training and campaigns against early marriage. In April 2008, UNFPA brought experts from Dhaka and abroad to the Sylhet Medical College Hospital for 3 days of knowledge sharing. Medical personnel and students watched closed-circuit television while 3 teams operated on 29 patients. Afterwards, participants discussed the procedures, the challenges they faced, and medical techniques.
Through this camp, there is big awareness raising among the professionals, and also it came in media, so there will be awareness building in the public also. So it will have, definitely I hope it will have a great impact in both in the prevention and also in the reduction of fistula, because the people will know that there is a treatment of this disease, because before many women doesn't know that it has a treatment. So they will come more and more for the treatment.
The 29 patients in the Sylhet exercise were a cross-section of Bangladeshis with obstetric fistula. Most had been abandoned by their husbands and ostracized by society. Some were in their teens. Others had suffered for decades. All hoped the operation would bring a new life. Rupuhar has lived with her mother since developing fistula 20 years ago. After her mother went blind, Rupuhar had to support them both with odd jobs and by begging. They lived hand to mouth. Please help my daughter. If the doctors succeed, she can be cured at last. Shati's middle-class family could have afforded a hospital delivery, but she didn't have one and things went wrong. Unlike most of the patients, Shati still lives with her husband. Shati has written a poem about living with obstetric fistula. A woman with fistula has no peace. She can't even sit with her neighbors. Abandoned by her own family, with no home or support, where can she go? Bilkiz, one of the youngest patients, was anxious before her surgery. Her life story was a hard one. An orphan, Bilkiz was married off at 14 to a much older man. Initially, she was glad to leave the orphanage.
I didn't mind being married at first, but then he started to beat me.
Bilkiz soon became pregnant. During labor, when the baby did not come, an untrained attendant waited too long to seek help. Bilkiz lost her baby and nearly died before she got to a hospital. Then her husband rejected her because of her fistula. Bilkiz was very frail and her injury severe. This posed a challenge to the surgeons.
So obviously she had quite a long obstructed labor because she had a huge hole that occupied almost the entire space between the cervix and the urethra. I think the operation took about 2 hours, and I hope she does well after that.
Since 2004, UNFPA has provided support to the country's premier facility for fistula surgery and training at Dhaka Medical College Hospital. Patients often need care for several months before and after surgery. To help the Dhaka hospital handle a growing caseload, UNFPA last year opened a dormitory and training center for pre- and post-op patients. Residents attend classes and learn practical skills. Their average age is 16. Nasima and Mahinur are learning to read while they recover. Nasima was 12 when she got married and developed fistula soon after. Now I feel good. I have been taught to sew, and when I leave here, I will get a sewing machine. Reshma, a former patient, has returned to her parents' home in a village north of Dhaka. Before my operation, nobody would look at me or smile at me. Now it's different. I can go anywhere in the village, and people talk to me. Obstetric fistula is widespread in Bangladesh because 85% of women give birth at home, and only about 3% of them have skilled attendants. Maternal mortality is also high. At least 320 pregnant women die for every 100,000 births. But the country is making progress in addressing the causes. With support from UNFPA and others, Bangladesh is expanding the training of midwives, known here as skilled birth attendants, and encouraging women to use their services. The number of villages that have midwives is growing steadily. Halma Akhtar, a midwife since 2004, helped 150 women deliver at home last year. Her latest patient is Lima, who was married at 15 and had her first child 2 years later. The delivery was normal. It took about 10 hours. Now, to protect her health, I'm advising her to wait before becoming pregnant again. Many Bangladeshi girls still marry young, putting them at high risk during childbirth. But thanks to advocacy campaigns and free secondary schooling for girls, the average age of marriage is increasing. Sultana's parents are adamant that her younger sisters won't marry early. For her part, as a campaigner to end fistula, Sultana has advice for young women in her community.
I feel bad when I see someone who is about to get married at a young age early. I tell everyone, don't get married young. You might suffer like I did.